Dr. Ken Landau. Thanks for watching. Let's talk about the flu vaccine. Each year, millions of people are infected with the flu virus, estimated somewhere between 5 and 10% of the population. That works out to hundreds of thousands of hospitalizations, somewhere between 140, maybe 700,000. Tens of thousands of people die. The exact number is argued about, maybe anywhere between 12,000 and 56,000. But most recently, the Centers for Disease Control, they said just 4,600 people. Well, the flu virus circulates basically between October and May, and since 1982, it's getting a little bit later. So after 1982 or so, we find that about 3/4 of the flu attacks peak in January or later, and in about 60% of the time, it actually is in February or later. And actually, a community can even get 2 attacks of the flu. Now, it's said that the flu virus vaccine is the best way to prevent both the sickness from the virus, from the influenza virus, and to minimize the symptoms if you happen to get infected. Now, it takes you 2 weeks from the time of the injection to get any significant benefit, at least as far as protection is concerned. This year, it's estimated that about 160 million people will be vaccinated, compared to about 32 million way back in 1990. But interestingly, while the mortality from the flu plummeted from about 1930 to about 1955, there wasn't any flu vaccine available. And during the pandemics, the bad years, supposedly 1957, 1968, 2009, there was really no peak in the deaths. And as a matter of fact, most of the people who have what we call, quote, the flu, well, they're really suffering from an influenza-like illness, and they don't actually have the flu. And as a matter of fact, when hundreds of thousands of people were tested who are complaining of symptoms, well, we find that maybe only 1 in 5 or 1 in 6 actually has the flu. Now, is it a bad disease in children? It certainly may be. Death in children is a reportable disease. There are anywhere between 30 and 170 deaths in children over the course of a flu season. Last year it was about 80. Adult deaths, as we said, the number is arguable. If we look at people who are elderly, living in their own homes, not in nursing homes, not in any other institution, there's some evidence that they get no significant benefit against either the influenza-like illness, or against pneumonia. Well, there's circulating flu in the United States, and it tends to be either influenza A or influenza B. There is an influenza C, but it doesn't cause significant problems. There are different types of influenza A and different types of influenza B. So the influenza A, we call it H1N1, H3N2. Those are the 2 kinds. And we call it the Yamagata or the Victoria. Those are the standard B viruses. Now, the H stands for hemagglutinin. It's a protein on the surface of the cell, and it's important for the viral attachment. There are 18 different types. So you could have an H1, H2, H3, H4, H5, H6, and so on. And the neuraminidase, the other one, the N, there are at least 11 subtypes of it. Now, during the last flu season, about 70% were influenza A and about 30% were influenza B. We have several different kinds of vaccines. We have the trivalent that protects against 3 of the viruses, and the quadrivalent that protects against 4 of the viruses. Now, the vaccine requires an injection. And the standard vaccine, the trivalent vaccines, are either inactivated influenza, so in other words, the virus is killed, it's grown in eggs, and we find that it's very safe, very effective, but it's all dead, so you can't get the flu from the flu vaccine, or we have little pieces of the virus, not even the whole virus. That's what we call the recombinant vaccine. Again, you can't get the virus from the vaccine. We have the standard trivalent. Now, more recently, we have the quadrivalent. When we're talking about the standard vaccine, the trivalent, we have high dose for more elderly individuals that has 4 times the amount of the antigen or the protein in it that's going to stimulate your body's antibodies. And then we have another kind of vaccine that has what we call an adjuvant in it. an adjuvant that stimulates your body to produce even more of the antibody, but that doesn't seem to work so well, evidently. We have the quadrivalent that protects against 4 different kinds of viral strains. Good news about that is it can be used with a smaller needle, and it can be injected just like insulin in the skin itself, not in the muscle. And it's for people between the ages of 18 and 64. Now, we have several different types of the quadrivalent vaccine. It's important to realize that as we grow the virus, we have to pass it multiple times in order to get it to grow well in eggs. But in doing so, we change the virulence. And that means that the vaccine efficiency, or the likelihood of the vaccine helping you, can be significantly changed. Now, the antibody that the body produces is against that hemagglutinin. And remember, that's what's necessary for attachment. But we don't know that that's really the way it works, and we don't have any good evidence that the level of the antibody determines the level of protection. So the recommendations from the ACIP, that's the group, the Advisory Committee on Immunization Practices, they say that everybody over age 6 months ought to get a vaccine, and that's been the recommendation since about 2010. And you should get it with either the inactivated influenza virus vaccine or the recombinant vaccine, and the government doesn't really care. They say they're all pretty much the same. Just don't use the live nasal spray, the inactivated or the attenuated virus. That doesn't seem to work as well against the H1N1. Now, the recommendation is to get the vaccine in October so that you'll be prepared when the flu season rolls around in late November, December maybe, or more likely in January or later. Now, the manufacturers begin to ship sometime between August and November, and they ship until the supply is gone. You get the vaccine at your doctor's office, at the pharmacy, the health department, maybe the school. And it's important that you get the vaccine yearly, since number one, the antibodies fall very rapidly, and number two, since the virus changes a little bit, the vaccine that you get 1 year probably won't give you much protection for the following year. If we're talking about children less than age 8 and they've never been vaccinated, they require at least 2 doses. Everybody else gets 1 dose. But if you're a child less than age 8, never had the vaccine before, you need 2 doses a month apart. And since 2004, the government recommends that even pregnant women get vaccinated. People who are at highest risk for complications of the flu, well, people who are young, less than 5 years of age, or people who are older, over 65 years of age, or people with chronic medical conditions, maybe like cardiac disease or lung disease or diabetes, or people who've had strokes or immunosuppressed, have AIDS, women who are pregnant, or people who are obese. The likelihood that the vaccine is going to give you protection depends on your age and your health status, and also the closeness of the match between the virus used to make the vaccine and the virus that happens to be circulating around that particular season. And the match, well, it's very difficult to get an exact match, but we can still get some benefit even if the match is close but not straight on, because we know that the virus is going to have little drifts over a period of time. Now, there is the possibility that the virus, or the vaccine rather, can prevent either the flu or prevent complications of the flu. So in studies, there's been some evidence that you can decrease the incidence of ICU admissions by maybe 70%, decrease hospitalization in people over age 50 by about 60%, decrease cardiac events in people, especially if they've had previous heart attacks, decrease hospitalization by 60, 70, 80% if you're a type 2 diabetic, or 50% if you have chronic obstructive lung disease. And if we vaccinate a pregnant woman, we can reduce the likelihood that she'll get acute respiratory distress if she gets the flu by about 50%. And we also provide about the first 4 months of life protection for the newborn in at least 50% of individuals. So there is some benefit. Now, how do we choose the virus for the vaccine? Well, it's chosen by looking at the previous flu season, what kind of virus is circulating. And in February of the year the viruses are selected, either 3 for the trivalent, 4 for the quadrivalent. Manufacturers begin about 6 to 9 months before the flu season making the vaccine. They distribute a little bit of it as early as July. But you don't want to get vaccinated too early because, remember, the protection, the level of the antibodies is going to fall over a period of time. And if you get the vaccine too early, you get inoculated too early, well, it's not going to be effective. So side effects from the vaccine, well, number one, you cannot get the flu from the vaccine. And if we use that live but attenuated virus in the nasal spray, you can't spread it between people very easily. And you certainly don't get the flu from it because it requires the cooler temperature of the nose, not the warmer temperature of the lungs, in order to grow. Well, the shot can cause some soreness and some rash and some swelling, and it oftentimes causes a low-grade fever because it's an allergy attack. And it can cause some muscle aches. And even if you have an allergy to eggs, you can receive the vaccine. Now, we have different kinds of studies. The best studies are known as the randomized controlled trials, or randomized controlled studies. They give us what we call efficacy. Those are the best medical studies. But most of the studies done on the flu vaccine are what we call observational studies. Look at some people who have the flu, look at some people who don't have the flu, and compare them, and then decide whether the vaccine really worked. Well, first of all, you have to realize that there are at least 200 different kinds of viruses that cause the influenza-like illness. They all cause the same kind of symptoms. But since they're different kinds of viruses, well, the flu virus vaccine doesn't have any chance of protecting against, say, the rhinovirus or the respiratory syncytial virus. And certainly, there's limited evidence that if we look at older people, very limited evidence, that the vaccine is going to decrease the severity of the illness should you become infected. And we also have evidence to suggest that there's less benefit in children who are less than 2 years of age than children who are older. Well, if we look at the effectiveness of the vaccine, we find that with your first vaccine ever, you get much better coverage or much better results than you do when you get repeated vaccines. And it's thought that once you get the first vaccine, your body makes some antibodies, and then you get the second vaccine the next year, where you have some kind of antibodies or something happens to make the shot less effective. Well, if you get the flu, we know it incubates for about 1 to 4 days before you become symptomatic, and you become symptomatic on days 5 to 10. Symptoms last maybe about 5-7 days, something like that. And we know that the influenza-like illness, all of the influenza-like illnesses, cause the same sort of symptoms. The flu or any of these other 200 viruses can cause a fever of over 100, some cough, some sore throat, maybe some headache or malaise, achy feeling. But we know that of the people who think they have the flu, the actual flu virus may be the cause in as low as 7% to as high as 50%. The average is somewhere around 20%. Now, interestingly, a study from Spain showed that the vaccine effectiveness from those observational studies, it was 61% effective in the first 100 days after the shot was administered. It was only 40% effective between days 100 and 120, so 4 months. And it was only 35% effective after 120 days. Well, if we look at the risk of infection after 120 days compared to less than 100 days, we find that the risk is about 4 times greater after 120 days. And if we look at people who are over age 65, compare them more than 120 days after the vaccine to less than 100 days after the vaccine, it seems that the likelihood of the flu is increased by about 21 times. A study in the United Kingdom showed that for the first 90 days after the vaccine, you were protected in about 50% of the cases. So it had 50% reduction in you're getting the flu. But after 90 days, it fell to about 12%. Well, flu virus is not recommended that you get during the same season another shot to boost your immunity. We've had some pandemics, some very bad flu, But the last one was really about 1918, 1919, the Spanish flu. The deaths from the flu aren't from the flu itself, but from the complications of the flu, typically either the heart disease or bronchitis or pneumonia. And it's important to realize that people have said that the vaccine can reduce the deaths by about 50%, but that's nonsense because the minority of deaths during the flu season, even in the elderly during the wintertime, the minority of the deaths have anything to do with the flu. So in order to decrease the likelihood of death by 50%, you would have to significantly reduce the likelihood of deaths from heart disease and stroke and car accidents and falls and fires. An interesting statistic is that if we look at the baseline risk of death during the non-flu season, the summertime, and people who did not get the flu vaccine, we find that in the summertime, the people who did not get the flu vaccine are at 60% greater chance of dying than the people who received the flu vaccine. So what does that mean? Does that mean that the flu vaccine protects you year-round? No, it doesn't. What it means is that there are confounding factors, or what's known as the healthy user effect. So the people who decide to get vaccinated have a better lifestyle, better income, they're more educated. And as a matter of fact, we know that in 2004, the vaccine production fell far behind, so 40% decline in the immunization rate, but there was no increase in mortality. And in 1967, 1968, 1997, there was a significant mismatch in the vaccine and the circulating virus. So in effect, there was no protection, but there was no increase in mortality. And over the past 20 years, we've had a dramatic increase in the number of immunizations, but no decrease in the death rate. And that's true in seniors too. More seniors are getting the vaccine, but the death rate in seniors is stable. In 1989, 15% of the population was vaccinated. Now it's about 65%. But again, there is no decrease in deaths from the flu. Well, the Cochrane collaboration is a very well-respected group, and they evaluated the vaccine studies. And Dr. Thomas Jefferson found that there were really only 4 studies that were conducted properly. 2 showed that there was no benefit, and 2 showed that in otherwise healthy school-age children, there might be some benefit. So the question is the vaccine necessary for those in whom it's most effective? In other words, young people, healthy people, and is the vaccine effective, to quote them, in those in whom it's necessary, people who are older, people who have compromised immune systems. So the likelihood of protection from the vaccine falls at a rate of 7 to 10% per month, so that after about 4 or 5 months, you have no effectiveness, no benefit from having the vaccine. And if you received a vaccine the prior year, or the prior years, then the effectiveness of the vaccine seems to fall even more rapidly. Now, we have a nasal spray, but the nasal spray is not recommended because for 3 seasons it didn't seem to provide protection against the H1N1 virus. And the statins that so many people are taking to reduce your cholesterol may reduce the effectiveness of the vaccine for the H3N2 virus, not for the H1N1 virus, not for the B virus. So the question is, what about the cost? Well, the cost is relatively small. It's a good bargain as far as healthcare is concerned. $15 to $20. The high dose, the 4-time increased dose, costs you about $40 overall. Sometimes some people can charge up to about $160, but overall you can get the vaccine at Target or Walmart or Walgreens. They usually advertise between $25 and $40. So in summary, there's a lot of uncertainty about the flu vaccine. In spite of all of the hype about how important it is, there is a lot of scientific debate and uncertainty whether the vaccine is effective in preventing the flu, whether it reduces the complications, and whether it's really worth all of the time and effort that seems to go into it. And for what it's worth, I've been in the healthcare field for more than 40 years, and during that time I had one vaccination against the flu, and I've never gotten the flu. So anyway, what do we think about the vaccine? Too uncertain. Don't know. Anyway, thanks for watching. I'm Dr. Ken Landau.